When did social media become the favorite ADHD doctor? ADHD diagnoses are skyrocketing, but here's the uncomfortable truth. Not everyone who thinks they have it does. Neuropsychologist Dr. Judy is joining me again today, and for us to discuss this on how some people might be getting it wrong. So, Judy, thanks again for joining us today.
Well,
Today.
I'm really glad to be with you again. And this is such an important topic. I'm really glad that you're talking about it.
Well, it's been something that's been sitting in the back of my mind for a while. I saw over
Yeah.
COVID there was a skyrocketing cases of diagnosis, and kind of wondered. There's one thing to be, inattentive and just unobservant or oblivious would be another one. And the one thing I did learn is, a lot of the mental health conditions that are out there have overlapping symptoms, but yet if you treat the mental disorder, then those symptoms will disappear. And ADHD, correct me if I'm wrong, is more of a chronic. So even if you solve the mental health issues, the symptoms are still there. The challenges are still there.
Exactly. And I think that people are probably rushing to get that diagnosis for themselves because they're just trying to find a solution, obviously. And then they're
Yeah,
looking on social media, they're looking at online articles, they're saying, oh, maybe this is what I have. But as you already just mentioned, Andre, we have the overlap. The overlap is so significant between what looks like prototypical ADHD symptoms and what might actually be depression, anxiety, or some combination. I mean, some people, of course, they have both diagnoses. They have ADHD, but they also have an anxiety disorder. And just saying that it's ADHD, you're not going to solve the entire problem and get to the root of the issues.
right. And maybe before we get too far into this, can you just give us an intro to yourself and your background? Because I'm not talking to someone who believes they know what they know. You actually have a background that's you're an expert in this field.
Well, thanks. So I am a board certified clinical and forensic neuropsychologist, and I'm also a tenured professor at Pepperdine University. I am a researcher. I have a private practice, and I also have authored several books. And so ADHD is one of my specialties. So I look at ADHD conditions across the lifespan. So essentially, I've diagnosed children anywhere from age 5 all the way up to adults age 95,
Mm-hmm.
but only when it's appropriate, right? And I think that also sometimes we see different signs of ADHD at different developmental timeframes. So a child who has inattentive type ADHD look very different from an adult who has an inattentive type ADHD, as an example.
And that's the special nuance that a lot of people in your field do not have, or the experience is that nuance. And that's why I really appreciate, like, you've already been on here to talk about self-sabotage. It was a great episode, and listeners, please go back and listen to that. But the main reason I got you back on is because on your podcast, Mental Health Bites, which are nice and short and very well choreographed, very nice. But you titled one called "Are We in an ADHD Epidemic?" And that's where like you said, we need to talk about this so people can understand the difference. And the one thing is, like you said in there, is social media is now a popular diagnosis tool.
Yep.
And why would people fall into that trap? Or I know you had some thoughts about that, and I'd like you to share that with my listeners.
Absolutely. I think that part of the issue and also part of the good thing about having information at our fingertips that people feel much more proactive. They're able to find out more information. If it is good information, it's more at your fingertips, right? So
Right.
I am in my 40s. So when I was growing up, we didn't have that kind of information. You kind of had to wait to
The
talk to the
encyclopedia.
specialist.
Yeah.
Oh, that's right. Well, I did used to have, do you remember those thesauruses or
Yeah.
like, yeah,
Raj's.
exactly.
Yeah.
Encyclopedias, and then the people come door to door, they sell, these volumes of books that you would literally for like A to Z for information. But I mean, no, you couldn't just find out
Yeah.
specialty medical or mental health information just by looking around. You literally had to wait to talk to the specialist. And now there's so much information and some of it is more credible than others. So again, the pros is that you feel more proactive, you can do this. But at the same time, there's a lot of bad information out there. There are people summarizing what they think they understand from something like the DSM-5, which, as you and maybe some of your
Yeah.
listeners also know, is a diagnostic manual for mental health professionals. They think, oh, okay, I'm going to read the criteria and I'm going to know how to summarize that. But, these are well-intentioned reporters who may not actually have the background to be able to summarize it correctly. But then it's kind of like a game of telephone. Then like one other article source will cite the other one, but they're not going back to the original source. And you can see how even well-intentioned people can end up spreading misinformation that's out there.
The one, like, do you think a lot of that kind of information or recommendations is anecdotal proof
I
or information?
Yeah. I mean, I think that anecdotal information obviously has its place, right? Because you have what it says in the manual, and then you have the nuances of how it actually shows up in every single person, right?
Yeah.
And there's going to be those individual differences. And I do think that listening to those anecdotal stories is helpful. But I think sometimes people will take an anecdotal story and they'll just run with it. They literally will just say, okay, well, that describes everything and all of my problems. And then they go to a mental health professional and then they're essentially seeking a diagnosis. And I've seen that a lot in my work. So people will come to me and they'll say, I have ADHD. They
Mhm.
literally will say that, and they're just asking me to confirm it. They're not actually asking me to do my part, my expert evaluation to actually see what's really going on. They're really fixated on having this diagnosis because also, I want to mention too, Andre, that a lot of people actually find ADHD as a diagnosis much easier to digest and accept than maybe other diagnoses like addiction issues, like obsessive compulsive disorder, like trauma disorders, like mood disorders. Somehow ADHD feels a little bit more acceptable to some people, and they're really hoping that that's what's explaining everything that's going on.
So that's an interesting you say, because even 4 or 5 years ago, it was almost like a death sentence to have that ADHD diagnosis. Like, it was bad, you suck. But it's gotten very popular now, fatty,
Yeah.
almost trendy, and that's the pattern I'm kind of seeing. So
Yes.
is that what people are wanting to do? That's the latest trend, and I'm not trying to say they're doing it on purpose. Like, it's
Mm-hmm.
all, don't get me wrong. Trying to understand and get an explanation of things when you don't fit well in society or in your environment, I get it. But the important thing is to get the right diagnosis, not one that suits, just because everyone has it.
Yeah.
Is that's not the right way, because you want to get the right help, the right solution, so you can go down the right path and get better self-acceptance, less self-sabotage. I'm just
Yeah.
meandering now, so sorry. But the question is, it's becoming trendy. Are you seeing that a little bit? Because
Yes, yes. I think that you're describing something that's happening. And I do think that part of it, again, there's always the pros and cons to every scenario. And I think that it was probably born out of people saying, hey, we shouldn't stigmatize mental illness, right?
correct.
And there's strengths of people who have ADHD. And we started to clear up these misconceptions. Like a lot of kids with ADHD, if they were diagnosed in childhood, they just thought that they were stupid or
Mm-hmm.
that they were so different from others in a bad way. And people are saying, no, your brain just works differently. But we're having so much proof that obviously people with ADHD are just as smart, sometimes even smarter than the average person. So obviously we're clearing up those misconceptions. We're starting to see the strengths of people who have ADHD. So the good news is that we have cleared those misconceptions. The bad news is now it kind of feels like, well, it's a little bit easier of a diagnosis to accept than maybe the actual diagnosis that's truly troubling me. And so people
Mm-hmm.
are seeking that diagnosis more. I'm seeing something similar in another diagnosis that overlaps a bit with ADHD, which is autism.
Yeah.
There is some overlap where people have ADHD and they have autism. And now I'm seeing people again on social media like, if this is you, you have autism. Just because you're socially awkward, that means it's autism. And so people are also coming to my office seeking that diagnosis as an adult and as well as teenagers. And then there's also have you seen the hashtag like ADHD? So then there's that whole
Yeah.
combination
Yeah.
diagnosis, and people are really into that. Like you said, is more trendy. I have autism and ADHD, right? But they're kind of neglecting that there's these other conditions that might actually best explain what's going on. And without getting to the root of it, you're not going to get the right treatment and you're not going to feel better.
So let's go down that road then. What conditions kind of have overlapping or ADHD like traits? Like borderline personality is one,
Mm-hmm.
depression, anxiety. What other ones would there be?
Exactly.
Autism.
Yep, exactly. Mood disorders of varying kinds, whether it's unipolar depression or bipolar
Bipolar.
disorder, um, addiction related issues. You may tell yourself that it's actually ADHD, but maybe it's actually internet gaming disorder or gambling disorder.
Oh,
Um,
that's right. I forgot about those ones. Yeah, good. You touched
Yes,
it.
because I think some people will say, well, see, like I'm showing that typical symptom that you see in adult ADHD, which is that hyper focus, right?
Hmm.
And they're saying that that hyper focus is what's leading to those addictive behaviors, but maybe and maybe not, right? Maybe that's actually not hyper focus of ADHD, and that's actually an addictive element that you need to address. Also, I see sometimes with varying forms of trauma and
Hmm.
post-trauma symptoms that people are saying, okay, that's ADHD, my impulsiveness or my recklessness. But PTSD and other forms of trauma focused conditions, there's going to be that impulsiveness, that irritability, again, because of that self protective mechanism that is a little bit more hypersensitive than the average person when you have been through trauma. So, those are some of the common ones that come to mind right now.
What kind of symptoms kind of are overlap those? Like the common ones, we can say, hey, maybe it can be a bunch of different things rather than just, most.
Yeah. Well, I think that some of the ones that overlap are the inattentiveness and problems with focusing that tends to show up when somebody has a mood disorder or an anxiety condition. And that's because both of those types of conditions, uh, there's a ruminative quality, right? There's a lot of, kind of going back and forth on your thoughts and maybe worrying about different things. And so, of course, when that happens, you can't concentrate because our brain actually does not multitask. Multitasking is a myth. You're actually just switching back and forth very quickly
Hmm.
between different things. So, of course, your attention is going to be disrupted if you have anxiety symptoms or mood symptoms that cause your mind to be filled with other thoughts, right? People sometimes say that it's hard to be organized and to even be motivated to be organized. That's another overlapping symptom. But of course, when you're depressed, you kind of have a low motivation to begin
Hmm.
with. So you're not going to want to organize yourself. It just feels like it's too overwhelming, right? So when people say, well, yeah, these tasks are overwhelming me and maybe that's ADHD, well, daily tasks overwhelm people who are depressed. I mean, literally taking a shower can be overwhelming for someone who is really depressed. So, again, that I think is another common overlapping symptom. And then on the impulsive, oh, go
Sorry, I
ahead.
want to get a little more on the overwhelm because I think it's a very one. Like my oldest is ADHD, but it's also anxiety. So I can
Mhm.
see the difference when the overwhelm is overstimulation of when too much input versus her overwhelm of anxiety.
Yeah.
And the thing is, this is why I keep having this conversation with people. Everyone in the world gets overwhelmed
Yes.
because of just life. Stress is another one that people will get overwhelmed, right? A lot of women at
Mhm.
home, mothers, overwhelm could be life as well. Or
Yes.
I'm trying to find an equal men example, but I'm having a hard time. But yeah, overwhelm is not just a medical condition. I think everyone gets it at certain times of their life.
Right, exactly. And like you said, you don't have to even say that overwhelm is something pathological, right?
Yeah.
Because people do get overwhelmed at varying times. And, just before we started recording, I was telling you that I had just gotten back from vacation. And yeah, that week right before you take vacation, also when you come back, is overwhelming.
Yeah.
I was like, oh my gosh, I have so much to do. I'm so behind, And so obviously that some of that's just normative. It's like life, right?
Yeah.
I mean, that sometimes
Yeah.
also happens. So don't just diagnose everything as if it's a problem.
Impulsivity. I think this will be a good one.
Yeah.
Overlap.
So impulsivity, the overlap of impulsivity. Well, sometimes when people are depressed, they're very impulsive, they're more irritable. So basically, they're set off a little bit more quickly than at other times. And so that kind of overwhelm can definitely come into play to actually show up as impulsive actions. When, as I mentioned before, when you have a trauma response, there's that impulsivity there. Like you blurt out something you don't mean to blurt out, or you have like an anger outburst, and people
Hmm.
think, oh, okay, that's the impulsive, hyperactive piece of things. Not really. That could just be the PTSD response. And then, of course, with anxiety, you're going to feel like you're driven by a motor and that you can't sit still. And so, is that ADHD, hyperactive, impulsive subtype, or is that just a manifestation of your anxiety? Or maybe is it a combination of both?
Yeah. Very great points. What about behavior and personality? Can that be misunderstood as ADHD traits? Like when I first got diagnosed, we're playing with borderline personality, and
Mhm.
I'm not too sure exactly how to explain it, but it just seemed to be a lot of, a lot of anger, a lot of maybe trauma. It just seems to be bunched into a part where you just isolate yourself from the world. And then if anyone comes near you, it's a protection mechanism almost. It's kind of how like, am I kind of close?
Yeah, you are close. I think that borderline personality traits, there's also some overlap with ADHD legitimately. Sometimes people have both diagnoses. But when you think about borderline traits, and especially some of those things that relate to feelings of interpersonal rejection, maybe being a bit more
Mm-hmm.
black and white, especially in social settings, sometimes becoming angry very easily if they feel interpersonally slighted. A lot of those things, I believe, are kind of some of the side effects of having an ADHD diagnosis in a way, because again, from a young age, you feel like you're different. So you're going to be much more sensitized to the social environment and whether
Thank
or not
you.
people love you or don't like you, right?
Right.
So I think that sometimes that gets overdiagnosed too. And by the way, borderline personality has been trending, but not in a good way, right? So ADHD
Yeah.
has been kind of trending in a positive way. Borderline traits is like trending in a bad way. Everybody is just throwing that term around, and it's like, hey, listen, not everybody has borderline personality. Come on, like
Mm-hmm.
sometimes people are having a bad day. Sometimes people are reacting to something in their past. Sometimes that's a trauma response. Sometimes it's something else. Like, so I see that being thrown out all the time. I'll have patients come and say, oh, yeah, my mom's totally borderline. It's like, don't use that term unless
Yeah.
you're really
Yeah.
sure. Yeah. Yeah.
Yeah. Well, I appreciate you saying that. Like, pent up negative energy for 40 years will have to be
Mhm.
released at some point.
Yeah.
And by you saying that, I've been wondering because emotional dysregulation is another DSM-5 tagline symptom, but I'm starting to
Yes.
have the idea, the concept. I don't think it is an ADHD thing. I just think it's a bunch of bullshit from your past that's finally caught up to you. And then, of course, you're going to blow a cork, right? Because I remember
Right.
being accused, you're impatient. And I'm looking at the scenario. Well, actually, I put up with that for 5 months and I didn't do anything, and no one seemed to
Exactly.
listen. So how are you supposed to react if you're not, if the environment didn't train you to release your anger energy in a positive way or in a mature way?
Oh, absolutely. I mean, emotion regulation is one of those things, or dysregulation rather, is one of those symptoms that cuts across diagnostic lines, right? So I know that that's been associated a lot with ADHD diagnoses, but I think it can show up at any time. My own
Yeah.
emotional regulation is not as good if I haven't slept well, if I am experiencing occupational burnout,
Yeah.
right? I mean, and I don't know if that rises to the level of a diagnosis, but I know it's a problem when it happens because literally I'll get upset over something that is so tiny. And I'm like, you know what? That obviously was an overreaction. So what happened there? Like, okay, but I think that that happens to the best of us on the worst days that we have. So I also think that that shouldn't just be pathologized or linked explicitly to ADHD
Yeah.
per se.
Like I
Yeah.
do believe it's the way I'm sensing it. I think ADHD is we're a little more sensitive to our emotions. Like the way it was
Yeah.
described to me is we feel it like at that maybe up to 1,000 times more than someone else. But I also
Mm-hmm.
put in is that I think we feel it intensely,
Yes.
raw, and immediate.
Yes. Yeah. Yeah. I agree with that. I think that a lot of times, um, people who have ADHD in general, there is a more difficult time with sorting through all the information to decide and prioritize what you should focus on and what is more extraneous, right? So when there is an interpersonal slight of some sort or some kind of environmental trigger, it can hit you all at once. And that does produce sensory overwhelm, right? So if
Yeah, yeah,
people with ADHD already are more sensitized than the average person because of their neurochemistry, and then they also can't sort out, well, like this is important to pay attention to, this is not, then that sense of overwhelm is going to cause you to react quicker. Because again, at the base of everything is the fact that we all just want to protect ourselves. Like, that's a universal human thing. It's like
that's the brain,
the
right?
that's the brain. That's the brain's like, I want to preserve you and make sure you survive. Right.
Yeah,
So that immediate reaction is a self-protective mechanism. So again, that part of it is not pathological, but it's the fact that the person with the ADHD brain because they can't sort out what's important, what's not. Sometimes everything comes with them at once, and then there's a sensory overwhelm that immediately triggers a fight or flight response.
Yeah, and I like you using the term sensory overwhelm because that's really what it is. And if correct me if I'm wrong, the sorting of information, our prefrontal cortex doesn't do it very efficiently. So part of that overwhelm is just an information overload because nothing in my brain's going, nah, ignore that, ignore this.
Exactly.
Okay, cool.
Exactly. Yep.
So kids in ADHD has been around a long time.
Mm-hmm.
Psychologists, psychiatrists, therapists, there's a little more exposure to kids. It was a kid, they think it was only a kid problem, and adults grew out of it.
Yes.
Um, Recently, adult ADHD is now becoming more common in the medical world and the
Yes.
psychology world. And it's relative, and I would say probably what, maybe 10 years at most.
Yeah. Probably
So,
only the last 10 years.
and even the last 5 years, I'm seeing a little more uptake with people claiming or having experience with adult ADHD. Because I think what I want to get to the listeners is we got to look for someone who has experience with adult ADHD because there's quite a different nuance. Because a lot of the DSM is kind of like based on a child still, somewhat.
Mm-hmm.
And then the adults we present differently.
Right.
So I guess what I'm trying to say to listeners is we try to find someone who's got adult ADHD because that's still relatively new to get a proper diagnosis. Is that fair to say?
I think it is still, yeah. I think that
It's
is
getting
very fair to
better.
say. It's
Yeah.
getting better. Yeah.
So how can someone get the proper ADHD adult diagnosis and really from who?
I think that it's really important that if you want a bona fide ADHD diagnosis, that you actually seek a neuropsychologist. And the reason is ADHD symptoms, as you're reporting them, if it's like a self report, that's where things get confusing. So even if you go to a licensed therapist or a psychiatrist, you're reporting your own experience to them. And they're like, okay, sure, like this checks the boxes, right? But I think the value of seeing a neuropsychologist is that you're actually going to get that full workup, which is the gold standard way of diagnosing. So that means that you're going to get cognitive testing. You're going to actually see on a performative level, is your attention actually worse than the rest of your functioning, right? And how is it affecting the rest of your functioning? Also, if there's anything else that might be going on, like a nonverbal learning issue or any other kind of learning difference, when you see a neuropsychologist, you're going to get all of that sorted out too. And the neuropsychologist, because of their comprehensive workup, they're also going to be able to really sort out the comorbid diagnoses, if there are any, much better because
Mm-hmm.
they're able to use real data, right? So not only do they use cognitive data, they also use questionnaire-based data. They might, for example, administer a questionnaire to you, but they'll also administer one to your parent, to your spouse, right? So that they can report on your symptoms, and they try to kind of collect that information together to see what actually emerges as the comprehensive picture. So if you are able to get a neuropsychologist, that would be the best. And actually, the good news is it is mostly covered if you have an insurance plan. So there are in-network neuropsychologists, and then usually they cover anywhere from 75% up to 100%. And even if it's out of network, most insurance policies will cover up to 50% of a cost with a out-of-network neuropsychologist. So those are just some things to think about if you think that cost might be an issue here.
Is that you're referencing the US, the United States
Yes,
insurance? Okay.
in the United States. Yeah, that's of course that's the system that I'm most familiar with. I'm not totally sure about the other countries. Yeah.
So I don't know if this is the first time I kind of heard of the term neuropsychologist. Can you explain to me the difference between a neuropsychologist and a psychologist? Because that's a new term for me.
Yeah. So neuropsychologists have essentially a specialty in the relationship between brain and behavior. So
Ah,
they
okay.
usually have specialty training in administering cognitive tests, like for your memory, for executive function. They like these are performance tests. So they're putting you through problem solving tasks that will tell you where you lie in terms of your performance, what are your strengths and weaknesses, where you are percentile wise compared to other people who have average age and education in your range. So neuropsychologists have that added experience. General psychologists, that's not necessarily an area of specialty for them, even if they are quite adept at everything else.
Right. Okay. That's a
Yeah.
cool differentiator. Awesome. So social media is not your diagnostic tool. I think it's great that people are sharing their stories and
Yes.
you can feel heard and understood, and not
Mhm.
to take that as the golden rule, because even the people sharing their anecdotal advice or experience may be misunderstanding it as well. And with that, what I also heard from you, Judy, was don't go to your psychologist and say, give me an ADHD diagnosis. Go and ask for help and say, these are my symptoms that I'm
Mhm.
struggling with, or I believe I'm struggling with. And then to get on the right path of a diagnosis. Maybe it's not ADHD, it could be something else. And just for the listeners, I'll tell you one thing, if you're getting the proper help, they're not going to start off with ADHD first. They're going to check a couple of the things first. I started with therapy to see if it was depression, because they're starting to take stuff off the table to get to the
Mhm.
right place. Nodding your head, Judy. I think that's one of the right procedures
Yes.
to go.
I love the way that you recap that. Go and tell them what your symptoms are. Just go with an open mind, right? Instead of going in and saying, uh, hey, I have ADHD and here's why.
Yeah.
Yeah, just tell them your symptoms and let them do the workup, right? Even if you have something in the back of your mind as a hypothesis, definitely you're right to do that. That's awesome that you've done the research, but let the professionals do it. Like you said, social media is not your diagnostic tool. Although I think one pro of that is you just don't feel alone, right? You read somebody's story and you're like,
Mm-hmm.
oh wow, that describes me. Okay, good. It's not just me. But that's a great use of social media, I think, but not as a diagnostic tool.
Yeah, and to point out is you use the term sensory overwhelm, and I really like that. And I think no matter who you are, sensory overwhelm is true. It happens quickly, and it's just that it's an overwhelm. It's not a personal fault or a moral fault. It's just, if you have the ADHD brain, it just takes it all in, freaks out, and then it just impulsively comes out. Because, like you said, the brain's there to protect you, and it figured out with time based on your past programming is,
Mhm.
for me, I'm a fighter. It's just I'm out to fight. Well, some will flee and some will fawn. So
Exactly.
to keep all that in mind. And in the end, everyone has ADHD traits at different times of life and situations. So it is not always ADHD. So for you to have a healthy future, you need to get the proper help and support and get the right diagnosis. And this is what I wanted to talk about today. It's not to disprove or say you don't have it or not everyone has it. It's to go on the right course of treatment. Because if you're treated for anxiety, but you have depression, you're not going to get the results you want, and it might make it worse or whatnot. And mental health is so important nowadays. And I'm not just saying that because it's trendy. I'm going through the journey myself. And if it was not for the mental health work I've been doing for the last 8 years, I wouldn't be here today. So
Yeah.
take care of your mental health, then your physical health will follow. So any last words, Judy, before we go? And make sure to let us know where to find you.
Yeah, so thank you. Thank you so much again for having this important conversation. I love what you said about, take care of your mental health and your physical health will follow because we know that they are inextricably linked, right? You can't just do one and not the other. So if you take care of your physical health, your mental health will also get better. If you take care of your mental health, your physical health is going to get better. So definitely feel empowered to make the changes that you need. And you can find me on social media at Dr. Judy Ho. I also have a YouTube channel. You can just search Dr. Judy Ho. It'll come right up. I have free resources on my website. If you sign up for my newsletter, you'll get all of those right to your inbox at drjudyho.com.
And make sure to check out her Mental Health Bites podcast. It's really good. And I'm learning lots of stuff. And they're bites, they're short bites. So it
Oh,
keeps my attention pun in.
right. I feel like that's why I wanted to do them kind of in a short way. I was like, you know what? Even I sometimes when I'm listening to a really interesting podcast, so once I hit that like 50-minute mark, I'm like, oh, okay, like this one's too long?
Yeah.
So that's why I did them in a shorter form, just like your podcast. It's like better if it's just a little shorter, people can kind of actually take away the main messages that they hear. So thanks for shouting that out.
Yep. Thank you again, Judy. And to you, the listeners, thanks again for learning with me. We'll chat to you soon.